Clark County has reached an agreement with Westcare to help fund the company's community triage center. That facility is the only one certified to act as a sort of emergency room to treat immediate drug, alcohol, and mental health issues.
Now, commissioners passed the funding on a split vote, and not before most of them voiced some displeasure. Our Patrick Walker joining us now to explain exactly what that means. Patrick.
Yeah, it's interesting because this is kind of a complicated issue, but also a very simple issue. So let's try to break this down as best we can. Westcare's community triage centers take in people who are experiencing those issues that you just mentioned, diverting them away from the county jail or UMC. The county has paid for part of the cost for operating those facilities for years now because it really actually saves them money in the long run. But 2 years ago, the state, local government entities like the county, even the hospitals, let their funding agreements with Westcare expire. Clark County in particular conducted an audit that they say showed Westcare, among other things, had billed the county for services that it was actually being reimbursed for by the federal government. Well, since the agreements ended, Westcare operated a handful of treatment centers across the state at a loss, including the last fiscal year, where nearly half of its patients were uninsured and therefore the services were being provided with no reimbursement. As a result, by May of this year, Westcare closed all but one of its community triage centers and said the last one could close as well. Some commissioners have lingering concerns, but Westcare officials say the company has made some big strides over the past few months.
So you're seeing those results of us raising our quality of care, providing a better integrated healthcare system coming out of Westcare, and putting those pieces of the puzzle together. We have decreased recidivism, we have decreased the number of uninsured and uncompensated folks coming through the door.
Going forward, how do you drop those numbers so significant when for 10 years that number hasn't changed? So it's concerning to me because there's no guarantee that they can do that, and what happens if they don't?
So here's where we are right now. Westcare is trying to negotiate new agreements with North Las Vegas, Henderson, and the hospitals. The county agreed to reimburse Westcare for about $275,000 in services that were provided through the end of June and is negotiating a contract to cover the current fiscal year. That would be fiscal 2019. Now, in all of this, Westcare officials tell me they do not plan to close the doors at that current facility that has remained open. Back to you.
Thank you, Patrick.